Welcome to Resource Sessions. I'm Gwendolyn Sterk of Sterk Family Law, and we're honored and privileged to have with us today Tina Konieczki of TK Insurance Services, Inc. Hi, Tina. Welcome.
Hi, thank you for having me, Gwen. I appreciate the opportunity to be here with you.
Well, we're very privileged to have you because we're going to learn a lot today about Medicare. And I know a lot of people with the aging classification, get nervous about starting and just where do you begin on that Medicare process? So the first thing I want to ask you is what services do you provide in the community?
So first of all, I'm a broker. I'm a Medicare. I help clients and people in the community to really navigate through the Medicare process, right? So helping them to really understand their needs and wants, doing an evaluation, asking them all the different questions to see if it's important for them at this point to even sign up for Medicare. A lot of people, they're not sure, should they start, should they sign up, should they not? And there's a lot of different variables that comes with that, whether if they're still working or they're retired or if they have a retiree plan. So a lot of different options that they have. So that's one of the things I do is really do, assess their information by asking them a lot of questions, do an evaluation of that and help them navigate through that process. So really just helping them navigate through the Medicare process. A couple of things I do help out with, not just Medicare, but life insurance, annuities, short-term care plans, hospital indemnity plans, cancer, heart attack, and stroke. All those are very important, even under 65. They're very important to make sure that you are being properly protected. And that's what I really try to do is help people protect their assets.
Sure. A lot of people are going through and they not sure even where to start. So if they come to you, it's a free consultation, right? I mean, you're an insurance broker.
That is correct. And that's one thing, I tell everyone that comes to me, I don't charge for my services. I love giving the education. I have an education background. I used to be a teacher, and there's so much misinformation out there, and that's an issue, right? So you can call 10 different people and they're going to give you 10 different answers. So that's why it's really important to sit down to find out, what are your options and where you need to start, what's your end goal, what are you looking for, and just truly assessing the needs. So I don't charge for my services, but I help, whether it's helping them to sign up for Medicare and finding the plan that best fits their needs and wants, or really just helping them see what they currently are on, if they're still working, or if they're offered a retiree plan. I'll dive through that to really help educate them on that so they can make a more informed decision.
Sure. Absolutely. Now, let's just say that you're getting ready and you're eligible for Medicare and you're starting to get all those mailings in, right? So you're 64, you're going to turn, and all of a sudden the world opens up. You go to your mailbox every day and things look official, but they're not necessarily official. So what's your advice to somebody? How do you deal with that?
So the biggest thing we've learned, especially since we went through this COVID pandemic and there's so many people from home, they've learned to do a lot more scams out there. And so, that your entire world opens up to everybody because the information's out there. So you're going to be getting information from all over the place. You get a lot of phone calls, and, which direction you go, what is real, what is not. So I always encourage people to make an appointment, come on in. I can help them to understand all those things, right? I'm a broker, so I don't work for Medicare. I don't work for any of the companies that I represent. I work for my clients. I'm an advocate for my clients. So I do over 160 hours of education every single year. I have to pass exams for not only my AHIP, which is the state exam, but every company I represent, I have to pass a test and to be able to continue with those contracts, with the renewals. It's really important to me to continue that education so that I can bring that education to people in the community. So I love it when people bring in those big stacks of mailing.
Yeah, they're
all right. Let's shred these because you don't need them. Because after doing an analysis with them, I can help them make a more informed decision, so they don't have to worry about all the phone calls they get, all the mailings they get, because it's a one-stop shop. Right? They can come here and I can help them go through that process.
You know, and I know that even when they do get on Medicare, and let's say they came to you first, they're still going to get calls afterwards, just still trying to get them to change plans or whatever. The same thing is true. You'll give them ongoing advice if they need an insurance checkup, true?
Absolutely. And so that's one of the things I offer with my clients every single year. And I'm not just a one and done, right? Like a lot of agents that are out there looking to make a paycheck. I really like building those relationships with my clients. I always say to everyone, I adopt you as my family and friends. And so it's an ongoing relationship. Throughout the year, I do a lot of mailings out to my clients with, whether it's Christmas and birthdays and different holidays. We plan a lot of fun events. So I'm always staying connected. And then every single year, I offer my clients a free review. It's to analyze how their year has gone, how's it working for them, what's coming out. Medicare changes every year. Things change, plans change, doctors change, medications change. So we want to make sure that every year that they get the information that they need to make a more informed decision. So there might be something that's better for them in the following year. So every year the government gives you that time, October 15th through December 7th. And that's when they get the majority of their mailings, to try to draw them, to lure them in, to make those phone calls. But I set those appointments with my clients to come in. Sometimes it's over the phone, or we'll book into time for them to come in to evaluate what they have. And, if there's something better for them, we'll go ahead and get them enrolled. All plans are annually contractual. So it goes from January through December and starts again in January.
Good.
Again, I don't charge for those services.
Sure. So, I think that, certainly a number of people know that Medicare is something you pay for, but some people don't know that. And I'm always surprised in my field and occupation that you pay for Medicare and then you have to have a supplement plan. So let's start with payment of Medicare. Tell everybody about that.
Great thing. So that's one of the biggest misconceptions. We pay into Medicare ever since we started working, right? That FICA on your check, you're paying into Medicare. So Medicare is through the federal government, right? It's your Part A and Part B, your hospitalization and your doctor services. That's your A and your Part B. There is cost to that. First of all, Part A, a lot of people say it's free. I never say it's free because obviously you've paid into it. There are some people that didn't, and I have clients that have not, whether for one reason or another, they never married, because you can collect off your spouse. There's a lot of women that stay-at-home moms that never worked, so they never paid into it, so they can claim it off their spouses. But let's say you have an individual who never married, or they never worked and worked at least 10 years, 40 credit hours, quarter hours, and paid into that. Well, then there's a charge. They can pay for it and still get their Part A. And then there's deductibles. Every year those amounts change. The government sets those numbers. So like a deductible on your hospitalization Part A goes on 60-day increments, $1,600 deductible. And we all know and heard of these long-haul COVID patients that have been in the hospital more than 60 days. Days 61 through 90, it's $400 a day. Days 91 through 150, those are your lifetime reserve days. Once they're used, you only have up to 90 days with just original Medicare, and those are at $800 a day. Now think of the building, right? Those are your for your inpatient services, but your Part B is all your doctor services in and out of the hospital. And there's a cost for that. For the national average for 2023, it's $164.90. But what a lot of people don't realize is that depending on what your income is, can set what your cost will be. I have some clients that are paying up over, $527, depending on their income, right? If they're a higher earned income, the government looks back, Medicare looks back 2 years to see what your income is, and they will assess what you're going to be paying into Medicare every single month. So that's really important to know that, or you might be on the lower spectrum, right? So you may qualify for Medicaid or a program called Extra Help, which helps lower the cost of your prescription drugs. So it's really important to understand, what your cost is going to be prior to making that decision, what is in your best interest.
Right, and if you marry somebody that might be younger, and they're still making money, that can put you over the threshold and you're paying more for Medicare than you originally anticipated. So all those items are important to come through. Now that's only Medicare. Now let's move on, because this is just an introductory meeting to supplements. So talk about the additional or supplemental coverage.
Right. So there's a lot of things that Medicare does not cover, right? So there's a lot of holes. There's 8 holes in Medicare, we always say. So you want to know how to supplement some of them. There's a couple of different directions that you can go, whether your company is offering you a retiree plan or you can pick up a supplement. And we call it, the alphabet, right? You have Plan G, Plan N, you have some high deductibles. And really, I always say that's insurance for your pocket. That you cannot get that by itself. It complements your Medicare. It helps cover your Part A costs. It helps cover the 20%. There is a deductible on your Part B. So it doesn't go above and beyond that, right? It doesn't have additional benefits. And then Medicare doesn't cover prescription drug prescription drug plans. So it's important that you'll want to get that as well, because if you don't have credible coverage, obviously you can incur some penalties, not only on Part B, but also on prescription drug as well. And then, so that's one of your options, right? Is they have a supplement to help supplement the holes that Medicare doesn't cover.
Sure, and that's recommended for people to have that supplemental plan. But then you hear a lot of people that are out there and they hear of a plan, some kind of an advantage plan, and they kind of think, well, maybe I should go to that. Can you talk about an advantage plan versus maybe a supplemental plan that's going to be good all over the country?
Yeah, so there's so they've grown substantially over the last several years. And so there are private insurance companies. Supplements and drug plans are also private insurance companies. There's a variety of companies out there that offer the different types of plans. And Medicare contracts with these private insurance companies. So your Medicare is coming through that particular plan. A lot of the plans have drug coverage, and it goes above and beyond what original Medicare covers. So you have some of your dental, your vision, your hearing, your over-the-counter, wellness benefits. You have a variety of other benefits that are in that plan. All those advantage plans, you're not losing your Medicare because the Medicare is contracting with them private insurance companies. They rate them, they have to approve them. They rate them on a star rating of between 0 and 5. They assess them accordingly. So they have, every one of them have a max out of pocket, but it really kind of works a lot like your group insurance plans do, where some of them have, your co-pays and co-insurances as you go. They have, your drug plans in there. They have additional benefits, and they all have what's called a max out of pocket as well.
And then some of them are limited as to regional coverage, correct?
Some are local, some are regional, and there's actually some national plans out there that have some overseas coverage as well. So, and that's why it's important to do a true evaluation of what your needs and wants are. What's important to you. There's networks, right? There's HMO networks, which is a health maintenance organization. There's PPOs, preferred organization. So depending on if you're, on HMO, you have to have, most of the plans have referrals, and they're a smaller network, right? More coordination of care, where the PPOs is a preferred provider organization. So not only do you have the negotiated lower cost pricing within the plan, you also have the option and flexibility, as long as they accept it, to go outside the plan, you just pay a little bit more.
Sure, and I think that's important. A lot of people that are in 2 locations, a lot of seniors winter somewhere else, or they move around, or they might go to international plans. It's so critical that you sit down with a broker and say, look, these are my life plans, or my life plans have changed, and next year I'm going to be doing X, Y, and Z. And sometimes I think people feel limited, but they really can review this every year.
And I encourage them to, right? Because things change every year. Networks change, doctors change, medications change. It's really imperative that that people do an evaluation every year, renew their plan, and the government gives you that time, October 15th through December 7th, to take advantage of those, to see what's in your best interest.
Now you talked about an advantage plan where maybe everything's under the same umbrella, but as I understand it, there's also supplemental plans where it doesn't necessarily cover your prescription, and then you get the prescription plan separately. Can you explain that?
Yeah, absolutely. So if you're on your original Medicare and you decide to go with a supplemental plan that actually helps cover the holes that Medicare doesn't cover, and the Part A costs and the 20% on Part B. So and that's basically what it is, insurance for your pocket. There's no networks, there's no HMOs and PPO. There's guaranteed issue when you first when you first turn 65, first get your Medicare, you got that period of time, your open enrollment period, that 6 months having your Part B, like if you delayed it, where there's no medical underwriting questions, you can go to any supplement. And as long as you continue to make your premium, they can't cancel you, right? The government also has standardized them across the board. So it's really important, if that's the route you choose to go, you would want to be with a broker, someone like myself, because there's a variety of different reasons. You want to look at all the different types of supplements that's out there. So, because you're not just looking at pricing, you're also looking at, stability of the company. You want to look at it nationally, locally. Do they close their books? There's a lot of questions to be asked when you're looking at a supplement, and which one would be in your best interest. Some give discounts for household discounts and different things of that nature. And then obviously you would have to pick up a prescription drug plan, a standalone prescription drug plan. Right. So both standalone and Advantage plans, you have to live in the county that they're offered. They are not transferable. You would have to, obviously go into a plan that's in that county. You have to live in the county the plans are offered. But when you're looking at a drug plan, things change every year on that as well, right? Your formularies change. The doctors, your prescriptions may change. Right. So one of the things that a lot of people get hung up about is really understanding how a prescription drug plan works. And every drug plan has the same model across the country, pretty much, where they have a preferred pharmacy, they have a formulary, all the drugs that's covered on that plan. That's imperative to make sure that your drugs are covered. They'll tier all your drugs 1 through 5. Some have a tier 6, and you'll have either a copay or a co-insurance amount. They're always, they're step therapy, so they're always trying to put you on the lowest cost drug, typically your preferred generics, and if it doesn't work, they step it up. Some have quantity limits and prior authorizations, and that's really important for your protection, especially. And then if you're on a plan and the doctor puts you on a drug that's not on that formulary, you can always ask for an exception. Every drug plan across the country has the same model. There's 4 stages. You have a deductible stage, and the government sets the amount of the deductible, what the max is. For 2023, it's $505. For a lot of your standalone prescription drug plans, most of your Advantage plans don't have those deductibles, but nonetheless, on your standalone, most of them do. And so you're going to pay the full cost of your drug until you reach that deductible, and then you go into the second phase, which is called your initial phase. And in that, the company helps you start paying for that drug until you hit the threshold. The threshold in 2023 is $46.60. And so once you reach that, you go into what's called that famous donut hole that people don't like, right? So a lot of people get really confused about that. And basically the government says that you will pay 25% of the retail cost of that drug until you reach $7,400 when you hit for 2023. And then you go into the 4th and final stage, and that is the catastrophic, right? And so at that point, you pay approximately 5%, whatever's greater, $395 for generic, $985 for brand, through the end of the year. At this point in time, there's no cap on any drug plan in the country. I know they're working on that, possibly in 2025. They're talking about having it capped at about $2,000. So you can see how important it is that you do an evaluation every year to make sure you are on formulary and at the lowest cost, because there's too often I see people come into my office that they're not even picking up their drugs, or they're paying astronomical amount because the drug's not on the formulary. So it's important to do that review every year.
Right, and to determine if there's another plan that's better. Well, I have to tell you that, I think some people come in and they think, well, if I'm going to get Medicare and then I pay for my supplement and a drug plan, I won't have any additional cost. And I think that some people are surprised that they have additional cost from it. And when you're on a fixed income at retirement age, it becomes very difficult for people. So
go ahead. Sorry. No, I said there's a lot of things too that Medicare doesn't cover, or a lot of people have the misconception that Medicare covers or approves everything, covers everything, right? And then they find out really quickly that there's certain things like your physical, your annual physical is not covered by Medicare, right? You have to be in the hospital when you're inpatient in the hospital before they're approved to go to a skilled nursing facility. 3 moons, right? People think it's 3 days, or or may not even be aware of it, but just 3 overnights before Medicare will approve that. So there are prior authorizations that sometimes are not checked on prior, and then the patients are stuck with a hefty bill. Not only the Medicare, the 20%, but also are stuck with that entire bill because Medicare didn't cover it.
Correct. And I also think it's important that seniors consider going to a doctor that has that familiarity with Medicare, because I also think that it is that, geriatric or that senior doctor, if you don't have a doctor that's going to care about what Medicare is going to cover or not cover, you can get yourself into a hole real quick because you really don't know what's going on. And at that point, you're sick and you don't care. You just want help. And then you get a huge bill at the end.
Yeah, unfortunately.
Right.
I've seen that all too often that, they assume and don't do the due diligence, what's needed to make sure they're getting the proper care and it's being covered.
Correct. So, my head is spinning and I'm pretty familiar with the Medicare and I'm always learning something every year. So I'm sure that somebody listening out there is saying, oh my goodness, I don't even know. I feel so overwhelmed. How do I even start and what do I do? And I think that that's where your role comes in, because although we're talking in detail about all the rules, you're going to get some background information and be able to guide individuals through this, correct?
Yeah, absolutely. Because there's no cookie cutter plan out there. And the thing about Medicare, it's individualized, unlike group insurance where the spouse and, they're both together on one plan, or they may have someone who's under 26 on your plan. Medicare doesn't work that way. Everything is individualized. And so I'm able to sit down, ask the questions, understand your needs and wants and your concerns. And so I would love to, anyone who's interested in making an appointment or coming in and do an evaluation of what they currently have. And, even if it's a year out, right? So it's never too soon. So the more you learn, the more informed you can you can make a more informed decision. So I am a local agent. I'm not someone that you're going to get on the phone and not ever talk to again. I'm here in Tinley. I invest in Tinley. I live there. My office is over here in Tinley Park at 16557 South Oak Park Avenue. I'm here every day, and I would love to help you help navigate through that Medicare process.
Sure. So people can call you and check out your website and figure out where to go to next steps, correct?
Absolutely. At 708-350-4767. Check me out on the website at tkinsuranceservices.com, and like me on Facebook. So look up TK Insurance Services, or you can look up under Tina Konieczki. We do a lot of fun events. We have a fun event coming up this month, actually, rock painting. So just love to be involved in the neighborhood and really just have a lot of fun, and help it to be not so terrifying, to help simplify that process for you.
For sure. I mean, you think about it, you did an occupation your whole life that has nothing to do with insurance. You're looking at these Medicare forms and you put all this mail, which comes in what I would consider bulk, and you don't even know where to turn. So I always encourage people to reach out to a broker. Certainly, you've given us a lot of information today and we really appreciate it. Well, thank you so much for being with us today on Resource Sessions.
Thank you so much, Gwen, for having me. I truly appreciate it. Thank you, and y'all have a wonderful day. Look forward to hearing from you. Thank you.